My name is Kirsten Brownson, and I'm a surgical breast oncologist and assistant professor of surgery at the University of Utah and Huntsman Cancer Institute. I'm so very honored that this piece, Combating Patient Isolation, Breast Cancer Treatment During the COVID-19 Pandemic, which I co-wrote with Jake Erickson, current psychiatry resident at the University of Iowa, is under consideration for a 2021 Fellowship of Postgraduate Medicine Award for Medical Writing and Social Media. Writing this piece, published in kevinmd.com, is an endeavor that I'm especially proud of. It was written at the beginning of the pandemic in the United States. My co-author, who was then a third-year medical student, had just started his breast surgery clerkship, and I was assigned as his mentor, as I'm the educational lead. The evening before Jake's first day on service, we both received an email stating that the clinical activities were going to be suspended indefinitely for students. We recognized that this was an important step for the public good, given the burgeoning number of new COVID-19 cases. But the academic medicine community was saddened that students would not be rotating on our services, and the students were distraught about this interruption in their medical education. I did not want to miss an opportunity to teach a student about breast cancer, because each student we teach becomes a potential future advocate for breast cancer patients. Thus, I reached out to Jake to set up a virtual teaching session over subsequent weeks. During these sessions, we not only discussed the surgical management of breast cancer, but I also shared some of the challenges that my colleagues and I were experiencing during COVID-19. One issue that we discussed was the increased isolation that patients felt during the pandemic. And this was of particular interest to Jake, as he was an aspiring psychiatrist. He wished to learn more about the effects of isolation on breast cancer outcomes and voiced his concern that the COVID-19 isolation was likely to continue for some time. I asked Jake to prepare a brief presentation on the effects of isolation on breast cancer outcomes. Despite the pandemic, student and teacher were able to connect and share ideas about medicine. The pandemic challenged our usual approach to surgical teaching, which is traditionally centered around case-based learning from the patients that students meet in the clinic and in the operating room. We later co-wrote this article to alert others about this important topic in breast cancer care. Our publication highlights the double-edged sword of the necessary promotion of social isolation during the COVID-19 pandemic. While healthcare providers appropriately embrace social distancing in order to conserve scarce resources, limit viral transmission, and flatten the curve, and while breast cancer surgeons canceled elective surgeries, postponed breast cancer screenings, and moved patient encounters to online platforms for these same reasons, we cannot forget about the detrimental role that isolation plays in human diseases, including breast cancer. The exact mechanism through which social isolation negatively impacts breast cancer outcomes is not fully understood, but most studies suggest that isolation inhibits the body's ability to respond to and to fight off cancer. Importantly, the deleterious effects of social isolation seem to be tied to the individual's interpretation of this isolation. Thus, loneliness itself, rather than the physical distance between the individual and others, is thought to be the driving force behind these poor health outcomes. This nuance is critical because it reveals an opportunity that healthcare providers have to intervene during the COVID-19 pandemic to positively impact the health of patients. Specifically, we must not let physical barriers of social isolation become a place for loneliness to take root. We must leverage the technologies at our disposal to make the human connection possible, even when we are physically far apart. During virtual visits, it's imperative that breast cancer care providers take the time to investigate the psychosocial stressors affecting patients to ensure that patients feel heard. Early recognition of patient distress enables us to intervene earlier and to combat the effect on breast cancer. The physical separation imposed by the COVID-19 pandemic does not need to drive a wedge between the doctor-patient relationship that is sacred, and this relationship must be utilized to address the isolation experienced by patients in order to safeguard patient health. Thank you.